Thank you, Ranisha, for your introduction and for allowing me today to open this important event. We are already at the 4th month of the response to the COVID-19 crisis, and since beginning, many things have changed. We've seen entire countries in isolation, disruption of international flights, impact on economies. However, during this same period, not a single conflict has stopped because of the pandemic. Humanitarian crisis continued, and for many, unfortunately, these crises come as an additional emergency on top of pre-existing emergencies. In many of the contexts where we work as a humanitarian agency, essential services for water, sanitation, healthcare were already disrupted or very weak before. Even the basic recommendation on sanitation and hygiene, the WASH practices as main barriers to COVID-19 spread in preventive care, are a challenge for millions of people still lacking access to safe water and proper sanitation services. So there are many reasons for this dramatic situation, but one of the main causes is often linked to the possibility of powering up those services. Energy is needed for pumping stations, treatment plants, construction of new infrastructures, as well as for continuously operating these services. Being these centralized large-scale infrastructure in urban areas managed by water utilities or smaller decentralized solutions managed by communities. In any case, a reliable, affordable, and sustainable power supply is essential. So on one side, many are still focusing on the immediate effects of the crisis with an emergency healthcare approach, but we cannot avoid looking at the secondary effects that the crisis is creating on public services, in particular in this situation where systems were already weak and insufficient. So in fragile context, socio-economic effects are also impacting. And if we look at the loss of income sources on the side of the users and their capacity to sustain the cost of water and power supply bills, or the interruption of supply of equipment and materials to utilities to run preventive maintenance, we can clearly see that COVID-19 crisis is not only a health crisis. So I link to say here that investing on power supply is necessary today to activate healthcare, water, sanitation services, and to allow them to continue functioning with equitable access for everyone, in particular at this difficult time. Water pumping and sanitation services through renewable power supply make water utilities and communities more resilient to situations like COVID-19 because they can allow uninterrupted access to basic essential services when they are most needed. So the technology is mature, it's present in all countries where we operate, it is affordable in terms of operating costs, and as we will see in the presentations today, simple and accessible enough to be maintained also at community level. So before closing, I would like to mention one document called COVID-19 and WASH, Mitigating the Socio-Economic Impacts of the Water and Sanitation and Hygiene Sector, that we at the ICRC co-signed together with UNICEF, the Global WASH Cluster, and other important NGOs. It is an advocacy document and a call for immediate collective and strategic action by national governments, service providers, and humanitarian agencies to continue investing on the delivery of essential water services, and I add here, including power supply as their main enabler, WASH services for all, in particular the most vulnerable. You will find a link to the document on the Energipedia website with the rest of the webinar materials after this call. I will close here my intervention, and I'm now looking forward to hearing from today's speakers and from the webinar participants. Thank you all, and back to you, Ranisha.